Journey of Hope: The Story of the Community Mental Health and Psychosocial Support Program 2003 to 2025. It all began with a simple yet powerful belief that mental health care should not be a privilege but a right for everyone. Back in 1961, Nepal took its first step towards this vision. The first psychiatrist in the country opened a psychiatric outpatient service at Bir Hospital in Kathmandu. It was a modest beginning, but it planted a seed, the seed of mental health care in Nepal. 2 decades later, in 1983, the service shifted to Lagankhel, establishing country's the only mental health hospital. And just a year later, in 1984, a quiet revolution began, the birth of community-based mental health care in Nepal. That same year, United Mission to Nepal launched the Community Mental Health Program as a pilot project in South Lalitpur, with heartfelt support from Tear Australia and FELM, two visionary partners who believed that compassion should go hand in hand with healing. Together, they brought mental health services closer to the people, not confined within hospital walls, but reaching villages, families, and individuals who had long been silent in their suffering. This was not just a project, it was the beginning of hope in the community. By the early 1990s, the movement had spread to Morang in 1991, Kaski in 1992, and Baki in 1995. The Western Region Community Mental Health Project soon followed, covering 10 districts and bringing care and dignity to the thousands. Then came a turning point in 2003, a year of transformation and courage. When the United Mission to Nepal decided to phase out 20 years of program, the dedicated mental health team faced a choice: to let years of hard work fade away or to take a bold step forward, to continue the mission on their own. With faith, commitment, and support from Tear Australia and FELM, they founded a new organization, the Center for Mental Health and Counseling Nepal, CMC Nepal. Born in May 2003, CMC Nepal was more than an institution. It was a promise to keep the light of community mental health burning in Nepal. From July 2003 onwards, CMC took charge of Western Region Community Mental Health Project, continuing expanding and evolving it into what is now one of the longest running community mental health programs in the country. Since then, this pioneer program has been a journey of compassion and change, running continuously for more than 2 decades and now entering its seventh phase, which extends until December 2025. In the early phases, from 2004 to 2013, the program reached out to 10 districts in Western region and gradually expanded to the new areas such as Makwanpur, Okhaldunga, Ilam, Dhading, Surkhet, Mugu, Bajang, and later to Morang, Rolpa, Salyan, Dailek, Acham, Doti, and Dadeldura. During the fourth and fifth phases, between 2013 and 2018, the focus moved to Udaipur, Okhaldunga, Dailek, Rolpa, Salyan, Acham, Doti, Dadeldhura, Bardia, Bake, Kailali, Surkhet, and Jajarkot, connecting hearts and healing minds across Nepal. Now, in its sixth and seventh phases, the program continues its work in Udaipur, Okhaldunga, Surkhet, and Jajarkot with refined strategies and renewed energy. As the program grew, so did its soul. During the second phase, the psychosocial component was introduced, integrating mental health with emotional and social well being. Initially implemented through local NGOs and later in partnership with government health institutions, this addition made the approach truly holistic. It marked a transformation from medical treatment to human connection. With this change, the program embraced a new identity, the Community Mental Health and Psychosocial Support Program, or CMHPSP. To reach wider audiences, CMC Nepal began producing radio programs that aired across local and national FM stations. Through the voices on the radio, people began to understand that mental illness was not a curse, that recovery was possible, and that help was within reach. Many listeners who once suffered in silence started calling in, seeking counseling and hope. The airwaves became a bridge connecting health stories and healing. In 2012, CMC Nepal took another bold step, adopting the right-based approach in its both community and school mental health programs. This approach went beyond care, it focused on empowerment and justice. Through this, self-help groups or SHGs were formed, groups of people with lived experiences and their families. These groups began to raise their voices, to claim their rights, and to demand inclusion in community and state structures. It was no longer just about treating illness, it was about restoring dignity. At the heart of this journey lies a single goal: to protect the right to mental health and psychosocial well being of people in the project locations. First, to ensure that everyone has access to mental health and psychosocial services close to home. Health workers, doctors, nurses, and paramedics have been trained and mentored to provide care. Health facilities are supported with counseling spaces, medicines, and awareness materials. Partnership with local municipalities ensures sustainability and accountability. Second, to reduce stigma and change the way communities think and act. Through orientations, interactions, and school based programs, thousands have learned that mental health problems are not shameful, but they are treatable. Teachers are trained in child and adolescent mental health, families are supported, and communities are mobilized to stand beside those in need. Livelihood programs have helped people rebuild their lives with confidence and pride. Third, to ensure that the government of Nepal takes ownership and integrates mental health into its policies and systems. Regular meetings, joint monitoring, and advocacy with all three tiers of government federal, provincial, and local have led to real progress. Today, many palikas have developed mental health policies and allocated budgets for counseling services and psychotropic medicines. Over the past 22 years, the program has touched hundreds of thousands of lives through direct care, counseling, awareness, and empowerment.
म पहिला एकदम लास्टै दुःख पीडामा बसेको मान्छे हो ठिक भयो नि त मैले रेगुलर 3 महिना मात्र औषधि खाएछ औषधि मात्र ठुलो कुरा पनि रहन्छ नि त आखिर आफ्नो दिमाग त हामीले आफै कन्ट्रोल गर्नु पनि पर्ने रहेछ अब त्यो मरेको मान्छेलाई सम्झेर पनि हुँदो रहेछ यसो झन् हामीलाई के हुँदो रहेछ तनाव हुँदो रहेछ अहिले कम्तीमा हाम्रो 4 वर्ष हुन्छ हाम्रो यो समय भएको काले सर भेटिनु हुँदैन थियो भने मसँग अब म यो दिन पनि आउनु थिएन होला के सर आजसम्म आफू पनि मरेर जान्थ्यो होला यस्तो मेरो साथीहरू पनि 4-5 जना मान्छे पनि यस्तै बोलापन भएर हिँड्नु भएको थियो उहाँ एकदम भित्रै बस्नुहुन्थ्यो उहाँलाई पनि मैले एकदम सुसमाचार सुनाएँ उहाँलाई एकदम मैले उहाँलाई पनि आफू पनि बसेर उहाँलाई पनि भने
मेरो शारीरिक अवस्था चाहिँ सर त्यो डिप्रेसनको कारणले गर्दाखेरि सबै शरीर डढेर कालो भइसकेको थियो अँगार जस्तो मानसिक अवस्था त एकदम विक्षिप्त केही गर्ने अवस्थाको थिएन स्वास्थ्य स्वावलम्बन समूह वडामा पनि छ हाम्रो जस्तो म जस्तै उपचार नपाएर चाहिँ उपचारबाट छटपटिरहनु भएको रोग चिन्नु नभएको उहाँहरूलाई चाहिँ उपचारले चाहिँ यो रोग निको हुन्छ भनेर चाहिँ सरसल्लाह दिने कामहरू अनि औषधि खानलाई चाहिँ जानुपर्छ भन्ने सरसल्लाहहरू दिँदै आएको छु सर
20-22 वर्ष अगाडि जस्तै 5 वटा औषधि पाइन्थ्यो गभर्मेन्ट पाउनु पर्थ्यो त्यो त म गर्वसाथ भन्छु पाउनु पर्थ्यो पाइरहेन्थ्यो अहिले 11 वटा औषधि पाइन्छ त्यो बेलामा लुकाएर राख्थे अहिले छाती फुलाएर बिरामी भई भनेर लिएर आउन सक्ने अवस्था छ
मेन उद्देश्य चाहिँ के थियो भन्दाखेरि नेपाली जनताको मानसिक स्वास्थ्यको अवस्थालाई सुधारोन्मुख बनाउन र मानसिक समस्याले ल्याउन सक्ने जटिलतालाई न्यूनीकरण गर्न चाहिँ एउटा मोडल दिन्छौँ गभर्मेन्टलाई स्किल ट्रान्सफर गर्ने खालको ग्राउन्डमा भएको हेल्थ वर्करलाई ट्रेन गर्दै जाने उनीहरूबाट सर्भिस डेभलप बनाइदिने भन्ने थियो सरकारी संयन्त्र सिस्टममा रहेर काम गर्छौँ देशमा बनेका स्वास्थ्यलाई सम्बोधन गर्ने कानुनहरूमा टेकेर एड्रेस गरे।
मनोचिकित्सकको सेवा दूरदराज पालिका लेभलसम्ममा डिसेन्ट्रलाइज गर्नलाई सहयोग पुगेको छ। औषधिको पहुँचमा सहज रूपमा चाहिँ तल्लो लेभल हाम्रो हेल्थ इन्स्टिट्युसनसँग पहुँच पुर्याउनको लागि त्यसमा सहयोग गर्ने कुरामा दुईटा त्यो कुरामा छ। त्यस्तै काउन्सेलिङ सर्भिस हाम्रो जुन पालिका लेभलमा काउन्सेलिङ सर्भिसलाई एभाइलेबल गराउने कुरामा पनि CMC नेपालले सहयोग गरेको छ। अर्को भनेको चाहिँ तपाईँको यो हेल्पलाइनमा पनि यसको एडभोकेसीदेखि लिएर CMC नेपालले सहयोग गरेको छ। राष्ट्रिय मानसिक स्वास्थ्य रणनीति कार्ययोजना आएको छ, त्यसले इन्भिजन गरेका रणनीतिहरूको इम्प्लिमेन्टेसन्समा नेपाल सरकारलाई प्रत्यक्ष रूपमा चाहिँ सहयोग गर्ने काम चाहिँ CMC नेपालले गरेका छ र हामी नेपाल सरकारको तर्फबाट CMC नेपाललाई धन्यवाद नदिइरहन सक्दैनौँ।
Thank you for walking with us through this remarkable journey, a journey built on compassion, courage, and the belief that every person deserves the right to mental health and dignity. Thank you to our long standing financial partner, Tearfund Australia and Australian Aid, whose unwavering support has made this work possible. Thank you to the Government of Nepal, provincial government, local government, and stakeholders, communities, health workers, teachers, self help groups, and every individual who has stood with us over the years. Your dedication has shaped this story. Thank you to the families and people with lived experiences who trusted us with their pain, their hopes, and their dreams. You are the heart of this movement. And thank you to everyone who continues to believe in the power of community based mental health care in Nepal. Thank you for keeping this mission alive. Together, we have come a long way. Together, we shall continue to build a future where no one shall suffer in silence and where care, compassion, and respect reach every individual and every home. Thank you for your support.